We're sure you're excited about the prospect of being able to see clearly after premium lens replacement. For good reason. Every year in the United States, over 600,000 patients have their vision successfully restored with premium lens replacement surgery. But having premium lens replacement, like any other medical procedure, has both risks and benefits associated with it. Even with the best of care, you could experience some of the side effects or complications mentioned in this program. As background, the eye focuses like a camera. The cornea and lens focus an image on the retina. When we're young, the lens is clear and flexible, allowing us to focus effortlessly from far to near. Invariably, as we age, the lens inside our eye grows cloudy and loses flexibility. As the lens undergoes these changes, we lose our ability to focus from far to near, and usually in our mid to late 40s will experience eye strain when reading and begin to use or need reading glasses or bifocals to focus from far to near. This aging process of the eye is known as presbyopia and is one of the early symptoms in the process of developing a cataract. With premium lens replacement, we're correcting presbyopia and any associated significant nearsightedness, farsightedness, or astigmatism before the onset of visually significant cataracts by removing the aging natural lens inside the eye and replacing it with a premium lens implant to help reduce and possibly eliminate your reliance on glasses. A cataract is a clouding of the eye's natural lens inside the eye, located just behind the pupil. Visually significant cataracts, which typically interfere with vision in your 60s and 70s, can cause your vision to blur and your color perception to diminish. Left untreated, your cataracts could continue to develop to the point of causing significantly blurred vision and an inability to perform tasks such as driving safely or reading accurately. In order for patients with visually significant cataracts to see clearly again, the cloudy natural lens eventually needs to be surgically removed, and in its place, an artificial intraocular lens, or IOL, will need to be implanted. So premium lens surgery is simply lens replacement surgery performed at a younger age before the onset of visually significant cataracts. Many patients in their 40s and older commonly associate LASIK surgery as the solution to correct their misfocus. Though we perform all laser LASIK and the results with LASIK are outstanding, LASIK makes an individual see normal for their age. The best time to have LASIK surgery is between the ages of 20 to 40. During this window of time, LASIK patients can have their vision corrected to see at all distances without glasses. Due to the normal aging process, if a patient in their mid to late 40s undergoes LASIK, then they too will see normal for their age and therefore see clearly far away, but require reading glasses to see the computer and to read up close. We have found that premium lens replacement is the best surgical option to correct vision for patients in their mid-40s and older who want to have the ability to see far, mid-range, and near with the least reliance on glasses. The advantages of premium lens replacement over LASIK in patients in their mid-40s and older are, number 1, more stable vision than LASIK for the rest of your life. Number 2, the ability to see clearly near and far without glasses as you continue to age. Number 3, premium lens replacement patients will never develop cataracts later in life and therefore not need to undergo cataract surgery in the future. With premium lens replacement using a premium presbyopia correcting lens implant, most patients are able to see in the distance, see the computer or mid-range, and read up close with little, if any, dependence on glasses or contact lenses. Premium lens replacement surgery is not covered by medical or vision insurance and is considered elective surgery, which the patient pays for out of pocket before surgery. Your procedure will be performed in our outpatient surgical center. 1 hour before your surgery, you will receive a Valium pill to help you feel more relaxed. Your eye will be completely numbed with local anesthetic eye drops. Then a small incision is made to allow access to the lens. Next, a circular opening is created in the capsular membrane that surrounds the natural lens to provide access to remove the lens. Then, using an ultrasonic instrument, the lens is gently broken apart and removed from the eye. The intraocular lens that you choose is then inserted into the capsular membrane that once held your natural lens. The incision is self-sealing and usually no sutures are required. Your surgeon may or may not choose to use a laser for certain parts of your premium lens replacement surgery. Whether a laser is used or not, your visual outcome is the highest priority. If the laser is critical to helping you see your best, then your surgeon will use it. If the laser does not help you achieve your best vision, then your surgeon may choose to not use it. You will be given instructions about any special medicines or treatments that will help with the healing process. It is very important that you follow all your postoperative instructions and that you return for all of your follow-up appointments. Your results depend on following your doctor's instructions. You will need to have someone drive you to and from your procedure. Do not drive yourself until your doctor has told you that you have legal driving vision. When you get home after your surgery, you should just relax and enjoy the rest of the day and avoid any strenuous activity. You may experience mild discomfort in your eye for the first 12 to 24 hours. If you continue to experience pain that cannot be relieved by medication, notice an increase in redness, or have any questions at all, you should call our office. How well you will see immediately after surgery varies quite a bit from one person to another. Some patients see improvement in their vision immediately, while for others, vision may be blurry and fluctuate in clarity for several days to several weeks, or occasionally longer. Most people resume their normal activities within a day or two. It is important that you understand that virtually everyone will experience improvement in their vision after surgery, but some people will not see 20/20 at all distances or in all light levels. This can be influenced by the overall health of your eye, the condition of your retina, and the unique optical characteristics of the selected lens implant that you chose. Also, as we get older, our ability to see in low light levels starts to decrease naturally, so it's always helpful to read under good light conditions. Although most patients are satisfied with their vision after premium lens replacement, it is not uncommon to wear glasses for certain tasks, particularly at night or in dim light. It may take several months for your eye to reach its full focusing potential, and your vision can continue gradually improving for as long as a year after surgery. You may choose to have surgery to your second eye as soon as 1 week after surgery to your first eye in order to optimize your binocular vision without glasses. Months or even years after premium lens replacement surgery, you may experience cloudy, foggy, or filmy vision. This occurs when the capsular membrane that originally surrounded your natural lens and now holds your intraocular lens in place becomes cloudy. In order to restore clear vision when this occurs, the cloudy membrane is partially opened with a brief laser procedure called YAG laser capsulotomy. You should understand that it is possible that your surgeon may encounter a condition or complication during the surgery that would prevent you from having the type of lens implant that you chose prior to the procedure. It's also possible that the estimated power of the implant selected could be too strong or too weak. This would result in the need for you to wear glasses or have a second surgical procedure to fine-tune your vision. It might also require that your lens implant be surgically removed and replaced with another implant. Although cataract surgery is among the safest medical procedures performed today, side effects and complications could occur. Some of these potential complications include infection or bleeding, macular or corneal edema, glaucoma, chronic inflammation, IOL dislocation, possibly requiring removal or replacement, rupture of the capsular membrane that supports the lens implant, a droopy eyelid, retinal detachment, especially for patients who are very nearsighted, residual nearsightedness or farsightedness, astigmatism, double vision, ghost images, impaired depth perception, trouble driving at night, perforation of the eye, loss of quality of vision, total loss of vision, and even loss of the eye in rare situations. Please understand that it would be impossible to cover all known and unknown risks and complications that have occurred in the past or could occur in the future in any program. Also, if you have any medical condition that you feel might put you at more risk, please be sure to tell your doctor. If you chose to have a premium lens to reduce or eliminate your dependence on glasses or contacts, it is important to understand that you may not achieve the results you were expecting, nor is it possible for your doctor to guarantee your visual results. Should you choose to have a premium lens, you will most likely notice glare and halos around lights at night. Most patients report these visual side effects diminish in intensity over time as the brain adapts to the premium lens optics. But these visual side effects may not go away completely. But here's the good news. In our experience, more than 98% of premium lens replacement patients have their vision successfully improved. So very soon you too should see better with less reliance on glasses for most activities. Now, just to be as realistic as possible about your expectations, there are 4 key points that we want you to remember before proceeding with surgery. Number 1, though your surgery is very safe, it is not possible to guarantee perfect vision or that you will be completely happy with your visual outcome. Number 2, if you choose a premium lens, you still may need to wear some glasses some of the time for some activities. Number 3, you may need subsequent surgeries to fine-tune your vision after receiving a premium lens implant. Number 4, you will see a halo around lights at night with your presbyopia correcting lens. These halos will not be visible during the daytime, but they will be visible at night around points of light. After this video, you will be given a written, informed consent that covers additional information regarding potential risks and complications. Please read this document thoroughly and have all your questions answered by your doctor or a staff member before signing. Don't rely just on this program to make your decision whether to have the procedure. Thank you for your trust and confidence in choosing Austin Eye and our eye care team for your vision correction needs. Have a wonderful day.